You would think it's really easy, just giving a medication to a patient, but it's such a complicated chain of events that must take place that there's a lot of room for potential error.
We know we're humans and that errors do happen, and that takes a toll not only on the patient, but the healthcare provider as well.
Closed-loop medication management is going to transform the way we provide patient care through safety, through consistency, through efficiency. The closed-loop medication management process transforms patient care from a paper-based, human, manual process into one with electronic movement of information, standardization of care throughout the system, and a robust checking process at every step.
Closed-loop medication management means to me being able to prescribe and provide a medication to a patient and really formalize that process so it's standardized.
One of the advantages with the Clinical Systems Transformation Project is that healthcare providers will have immediate access to the patient's complete health record. There are a number of steps that are going to be implemented. The first and perhaps most important is the electronic order having been entered directly by the healthcare provider. That order is then reviewed by a pharmacist and approved, and then filled by our technicians using the R-coded labeled medications.
So at the production center, when a patient-specific order is sent over, that file is then packaged, patient-specific, so it would be patient X, XY medication at the correct dose. Those medications would then be put through a machine that will take a picture of every single pouch, and those pouches would then be looked at by another technician.
The quality assurance that we need and we require at our facility is critical. We have a number of technician double-check processes involved, so we don't fully rely on technology. It's a balance of both.
Recently, we've been using Omnicells, and Omnicells are like these big vending machines, so to speak, of medications, but you can only get the appropriate medications with the appropriate information.
When the nurses access that cabinet, there can be alerts there. For example, this is a high alert medication. If it's given in air, it can cause significant harm to a patient. There's inventory control in there so that they know the medications are on the unit that you need when you need them. That smart technology is right down through the whole process, right through to administration. When they go to administer the med, they have their medication administration record right at the bedside. The patient has a wristband that is barcoded. The medications are all barcoded. They scan both of those, and everything has to align. If it doesn't align, the system will tell them.
In so doing, we close the loop between medication ordering and medication administration. The real benefit of this for the patient is less errors.
It's about time that we start giving our healthcare providers the tools they need to provide safe and efficient care.